My name is Nader, and I work at the University of Buffalo's UBMD Orthopedic and Sports Medicine Concussion Management Clinic and Research Center. So, we're a pretty large university-affiliated sports medicine practice with several outpatient and urgent care clinics. We cover all local professional and collegiate sports teams, as well as a lot of other club sports. And we provide them with physicians, surgeons, physical therapists, sports psychologists, occupational therapists, as well as a lot of athletic trainers. So, in addition to this, we also manage approximately another 100 athletic trainers in local middle and high school in all of Erie County as well as Niagara County. So, the source of all of the data for all of our research actually comes from a very, very large clinical machine. So, our research center, on the other hand, is very, very productive, and we are credited internationally for moving the concussion management from a rest is best approach to an early intervention and exercise rehabilitation approach. And today I'm going to be giving a presentation on the best practices for interdisciplinary or comprehensive post-concussion management, and with a large focus on the role of an athletic trainer in this. Okay, so I'm going to be covering aerobic exercise, neck, and oculomotor rehabilitation. I should have also covered balance rehabilitation since our athletic trainers also participate in that. But balance rehabilitation is so diverse and it's so specific to an individual need that it's actually very difficult to quantify how effective something is for peer-reviewed publications. So since I'm not going to be covering this, I'm actually going to provide my recommended resources for balance rehabilitation at the end of my presentation. And specifically, it's the work done by the researchers at the University of Pittsburgh Medical Center. So there is a potential conflict of interest that I do have to report. This program is sponsored by Headquarters Health Inc., and they'll be giving a talk they'll be giving a demonstration after my talk. However, I don't have any personal conflicts of interest. I'm just an unpaid advisor. I do this for multiple other medical device companies. And my research is funded entirely by the Department of Defense, the National Institutes of Health, as well as, a lot of local and national bodies. All right, so here's just a list of my concussion-related publications in the past 3 years. I have an almost equal number of non-concussion-related publications as well in the exact same time period. All right, so now I can start my presentation. So, concussions happen. They happen in collision sports like football when athletes are actively banging their heads against each other. They happen in contact sports like soccer. And not surprisingly, some of the worst concussions I've seen are from non-contact sports. Oh wow. Luckily, there are certified clinicians such as yourself to help identify, diagnose, and treat these injuries to help ensure a safe return to play. So, all of you know what a concussion is. It's an injury at the cellular level, and there's absolutely no abnormalities identified on a CT or MRI. And it is expected that patients will recover. So immediately after the injury, there is a lot of symptoms, and then slowly over time, these symptoms start to resolve. This differentiates it from a moderate or a severe brain injury, because in those types of brain injuries, when you actually see bleeds or a mass or something on an MRI or a CT scan, the expectations of recovery are not as great as they are with milder forms of traumatic brain injuries. So when I say most, approximately 70 to 80%. So most patients will return to sports. Now for adolescents, the return to sport time is approximately 2 to 4 weeks. And for collegiate athletes, the estimated recovery time is between 7 to 10 days. However, these numbers are reported by athletic organizations. Whereas if you actually look at other non-sports literature, such as the World Health Organization, they actually define persisting symptoms as those that last for more than 3 months. So the thing is, the kids or athletes who do not recover during this typical time period, they have something called persisting post-concussion symptoms, or PPCS, and this generally needs a lot of individualized intervention before they can actually get back to their pre-injury baseline. And sometimes that can take months. All right, so there are a lot of head injuries, but not every head injury leads to a brain injury. Now, fortunately for the sporting world, or unfortunately, depending on how you look at it, there are so many guidelines out there on how to screen for brain injuries, and what athletic trainers should do at the time of injury or within the acute time period, which is considered as like the first 3 days after an injury. Okay, so the most common guidelines are the ones called the SCAT, the Sport Concussion Assessment Tool 6, it's by a group called the International Concussion and Sport Group. They release these guidelines every 4 to 6 years, and the sixth version of these came out in 2022, and those are the most updated ones. So the SCAT can be used immediately after the injury on the sidelines, as well as in the acute period, which is defined as the first 3 days after injury. Because as most of you know, most concussions in non-professional settings aren't observed, or they happen in random places, like when an athlete slips and falls in the parking lot on the way to the rink. So in these things, most of the times, they only come to you a day or two after, saying that they don't feel right. So all of these concussions are clinically managed in the same way. These guidelines are very good for the first 3 days only, and their screening potential starts, as been shown, to get like really bad from like the 5th day of injury onwards. So the SCAT is pretty straightforward. There are things you only do on the field right after someone is hit. And as a clinician, you have to be quick and efficient. You will not have time to review these pages in the heat of the moment. Also, you never know what to expect when you're running on the field. So in these situations, you have to remember your basic life support training first. You know, is the area safe? Is the victim conscious? Are they breathing? Do they have a pulse? Is there bleeding? Do they know who they are, where they're from? Okay, these are all red flags. And whenever something like this is available, this is immediately you should call for an ambulance and stabilize the patient and monitor them as needed. So once all of that scary stuff, the online component, is done and taken care of, then you can actually go on to the concussion part of this analysis. So in this, you can typically take the athlete to the sideline of the game or in the athletic training room to begin this. So research has shown that athletes, if they're really, really exhausted, for example, they were playing a sport, they're running around for like an hour and a half, they're super exhausted. So if you do the SCAT while they are really, really exhausted, you're going to get a lot of false positives on the SCAT. Specifically, they do really worse on the cognitive tests, and their eyes don't really track that well. So if your athlete looks super exhausted, and as well as if they look dehydrated, then it's best to wait for about like 5 to 10 minutes and let them catch their breath before you actually start the concussion part of the assessment. So the concussion part of the assessment, it has those symptom checklists, those cognitive tests like immediate and delayed recall, as well as balance tests. So actually, one of the biggest things that I'm really surprised with, that the VOMS was not part of the SCAT-6. So this was something that we had expected that they would eventually incorporate this into the screening protocols. But surprisingly, it wasn't, which in my opinion is a pretty big loss because the VOMS is one of the most sensitive clinical assessments for concussions. But even regarding that, you pretty much total up all the scores from the baseline SCAT assessments, and you are supposed to compare this to an athlete's preseason baseline to see if you should